Sometimes a presence is so steady you may not notice it changing. For over 65 years, we've been constantly innovating. And in partnering with Ochsner, we continue to offer the most advanced technology with minimally invasive techniques for general surgery and for specialties from orthopedics to neurosurgery. Many have noticed, earning us the most accolades on the North Shore for quality, safety, and patient experience. St. Tammany Parish Hospital in Ochsner, shaping the future of health.
Hello and welcome to Healthy Living. I'm your host Melissa Hodgson, and we're talking today about robotic surgery. We'll talk with 3 local surgeons who rely on the Robotics Institute at St. Tammany Parish Hospital for the technology that enables them to do minimally invasive surgery close to home. First, we'll visit with Sunil Purut, local urologist. Sunil, thanks for joining us today.
Nice to be here, Melissa. Thank you.
I'm excited to be talking about this. You were the early adopter that really tried to talk the hospital into getting into the business of robotics back in the 2000s.
Yeah, I remember those days. You know, the Da Vinci robot is very technical, very specifically designed, instrument. And it's a very costly affair. And so, of course, when you're talking to administration, when you're talking to, the board about, spending, upwards of $1.8 million on a, technology, it's not that easy. It's not that fun. But we had a lot of, just a lot of experience in observing all these cases that were done early on in urology. And when the robot first came out, the FDA approved the robot in 2000. And soon after, the major institutions throughout the country were really embracing it in the field of urology, prostatectomies and kidneys and things like that. And so, we had a good feeling that this is going to be the future. And we better embrace it, or if not, then we're just not going to have it in this area.
Right. Well, and so urology was that area of specialty that could see what robotics could bring to procedures. And you're right, obviously in 2000 when it was first approved through the FDA, it was mostly in teaching institutions and major institutions around the country. There were major institutions in Louisiana that had it, but only a few. And so when St. Tammany bought their first robot in 2007, that was the first one on the North Shore. It was the first one on the I-12 corridor.
That's right.
It was pretty exciting, but the hospital stayed engaged in that, and that had a lot to do with what you were doing in urology. You can talk specifically, I think, about prostatectomy, for example. Before the robot, that was something that could not be done minimally invasive.
No, and actually, just for example, the average blood loss for an open prostatectomy nationally was between 1 and 1.2 liters of blood. And now with the robot, you were talking about 100 cc's, 50 cc's. We don't even type and match our patients for blood anymore. So that has been taken care of as far as a major issue. And then, so what that entails, you have patients that could be a little bit sicker, a little bit older, and patients that you'd be worried about, recovering from an open prostatectomy. You can do the same procedure in a minimally invasive fashion, and they go home the next day. And so it's amazing.
Well, and you look at that as our history from 2007, and then moving forward, we're up to 3 robots there at St. Tammany Parish Hospital. And you and your colleagues have achieved quite a milestone in 2019. You crossed the 5,000th case.
It's amazing, yeah. And it's only getting bigger and bigger. As, like you said, we started with 1 robot, now we have 3. And so that means that you have 3 rooms that are going sometimes at the same time. And so as patients come in, as the robot continues to evolve, we're able to do more and more complex surgeries throughout the field. Now even cardiothoracic cases are being done robotically, specific cases like valves and things like that. There's a lot of options out there for surgeons. And so, the sky's the limit, I think.
Well, I think it's really exciting from the patient safety standpoint. Like you were saying, much less blood loss, a much shorter hospital stay, quicker recovery. And in urology, can you kind of outline some of the specific procedures that you as a urologist are able to do as a result of that robotic surgery?
So we talked about prostatectomy.
Sure.
And the 3 advantages for that procedure: less blood loss. You can actually do a nice, what we call nerve-sparing prostatectomy where you can spare the nerves for erectile function. Incontinence is a big issue when you take a prostate out. Robotically, it's minimized, and usually within a few months, patients are pretty much back in control of their own urinary function. So with prostatectomy, we went to kidneys. Now, majority of the time before the robot, kidneys with cancers were being removed in total. If you had to do a open partial nephrectomy or open removal of a part of a kidney, that was a very morbid procedure. You know, patients were in the hospital for 4 or 5 days. Now we can do it where patients go home within 23 hours.
Wow.
And you know, you can basically take the tumor out, reconstruct the kidney, all within 30 minutes. And generally, you know, what that has allowed is for patients, like I said before, who are in their 70s and 80s, who have tumors, you know, you can actually get them through a treatment in a very efficient fashion, where they're home, they're back to their loved ones, they're back on track with their normal activities fairly quickly. So that was another big one. Another one is pyeloplasty, where we take a stricture and a ureter, so we can cut that stricture out and we can hook everything back together, putting the ureter back together with sutures. And before, you'd have this big hockey stick flank incision. Now you can do it through 4 little tiny incisions. What does that entail? You know, the recovery is, again, very easy comparatively. Less incision, less chance of infection, less scarring, quicker recovery, and that's what it's all about. So those are the type of procedures that are, you know. Another one that I'm really excited about is vaginal prolapse surgery. Okay. So, you know, a lot of these problems come up when patients in their older years, and before an open prolapse surgery would be a fairly, you know, morbid procedure in the sense that it takes, you know, maybe 2-3 days of hospital recovery, etc. These patients sometimes can go home the same day even. And I'm talking, most of these patients are older, again, in their 80s, late 70s. And so, you know, it has really opened the treatment platform for, you know, patients in the community. And it can all be done in the North Shore. They don't have to go to Houston, they don't have to go to New York, they don't have to go to the South Shore.
Right.
It can be done in Covington, Louisiana.
Well, and we're excited to be the host facility. St. Tammany Parish Hospital's Robotics Institute, that began with the first purchase of the robot in 2007, has grown, and now there's this wide variety of surgeons and specialists who are able to use it. And it does mean that we're meeting that mission of providing that level of world-class health care close to home on the North Shore.
That's right.
Well, Sunil, before you go, can you think, in your specialty of urology, what's the future look like with robotic surgery? What's coming next?
You know, there's talk about eventually, you know, basically meshing the CT scan with the Da Vinci robot on the same platform, where you can get an X-ray, a CAT scan, you can find a tumor, say in a kidney, and basically fill in the coordinates, and the robot could actually do the surgery, which is not good for, you know,
for surgeons.
But, you know,
you'll
it could
still
be more
have to
precise.
be in control at the console.
Well, we'll have to at least put the instruments in the patient and close everything up afterwards. But things like that, there, you know, are things where we can actually hopefully be able to inject some medication into the patient intravenously, and that might help us identify the nerves for prostatectomies more easily. That's being done in the lab, and hopefully eventually it's going to come out, you know, in the real world. And small things like that can make huge differences in treatment. So it's amazing. I think has it been 13 years, close to?
Yeah, 13 years since we got into robotics.
Started talking about and got into robotics. Urology has changed tremendously, and it's all centers around the robot.
Well, it's exciting times. Thank you so much for coming in and talking with us today.
Absolutely. Thank you for having me.
Up next on Healthy Living and our special about robotic surgery, we'll be talking with Dr. Patricia Brawley about women's cancer and how robotics help her to do surgery.
Thank you. Thanks. Thank you. Thanks for Sunny Face Eggs for my baby sister.
For my fishing buddy.
Thanks for my mama's gumbo. Thanks for my mom.
We enjoy receiving awards and recognition from our peers. But the true reward comes from seeing positive outcomes for our friends and neighbors. So thank you for trusting us. St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome back to Healthy Living. I'm your host, Melissa Hodgson, and we're talking today about robotic surgery. We spoke first with Sunil Pruitt, local urologist, who talked about the start of the Robotics Institute at St. Tammany Parish Hospital and how robotics has changed urology. Next, we'll speak with Dr. Patricia Brawley, women's cancer specialist, whose practice is in Covington. She'll talk with us about how robotic surgery adds to her practice and what it can do for patients. Dr. Brawley, thank you for joining us.
It's my pleasure, Melissa.
Really excited to have you here.
Thank you.
So you've been in practice in OBGYN and in women's cancer for decades.
Literally, yes.
Tell us
35 years.
35 years.
Yes.
And how many years were you in practice before you began to do robotic surgery?
Well, let's see. So I think I started shortly after Dr. Pruitt, maybe within the year.
7, 8, yep.
Yeah, and so over 25 years without, and I was one who trained before laparoscopy was as available and advanced as it is now. So I really went through my training and my early years of taking care of patients without doing much minimally invasive surgery. I really didn't like doing it. I came up with all kinds of excuses, you could say, about why we needed to do major surgeries with laparotomies and yes.
Your training was that open surgery, and you
Yes.
felt the safest thing for your patient was that open surgery?
Yes.
And laparoscopy, of course, is minimally invasive,
Right.
but without the robot, it does not have the same kind of visualization.
It doesn't have the same kind of visualization. It also doesn't have the same access as far as angles of the instruments, as far as going around tissue or tumors or opening up the retroperitoneal space and looking for lymph nodes and things like that. Much harder with what we call straight stick laparoscopy.
So what you found from your training in open and then the introduction of laparoscopy and then the introduction of robotics, radical change there.
Very, very, very big change. And so I would say one of the real advantages of having the robot is it's allowed both surgeons and procedures that used to be done almost always open now to be done with minimally invasive surgery.
That's exciting.
Yes.
So specifically in OBGYN surgery and in your case in women's cancer surgeries, can you talk a little bit about the kinds of procedures that women may have had to have open in the past that weren't laparoscopic candidates, but because of the precision that you have with the robot, that changes the game and enables surgeons like you to do those?
Yes. So the robot is being used extensively for both, for hysterectomies, both for benign indications and for cancer. For benign hysterectomies, one of the places that the robot has made it possible to do minimally invasive surgery instead of open is like with fibroids, big uteruses that potentially would be very difficult to do with laparoscopy or vaginal hysterectomy. So the robot's allowed for increasing the number of patients having hysterectomy for benign indications to have it done with minimally invasively. Another area in benign GYN is endometriosis. Endometriosis causes horrible scarring, and even with a big incision, it is very difficult to see maybe where the colon sticks to the back of the uterus or where the ovary is sticking to bowel or different structures. And the robot, because of the optics, we have high definition, magnified 3D vision with the robot, as opposed to with laparoscopy, we're looking at a TV screen.
Right.
And so that's obviously two-dimension, very, it's high acuity, but the 3 dimensions and magnification and being able to have the camera this far from where we're operating is very helpful. We also then use it for cancer, and one of the places where it has been, the robot has been particularly useful is in patients that are obese, because obesity is associated with endometrial cancer. And so we have lots of patients, many of them quite elderly, that are very obese, and doing a big open surgery, cutting through maybe this much fat in their abdominal wall makes it very difficult to get to the uterus and to remove it safely. And so the robot has allowed us to operate very safely and quickly and with minimal side effects or complications, even in elderly, very obese patients. We also, it really facilitates our ability to see lymph node, the area where the lymph nodes are. And one of the advances that is now available is we can actually inject a dye into the cervix, and then we can see the lymph nodes. It's called sentinel lymph node dissection. We can identify the first lymph nodes that the cancer would potentially spread to, and then there's a fluorescence technique with using the robot. So we can turn it on and off, and we can see things normally, and then we can switch it and we can see these glowing green lymph nodes that we can remove. Wow. It's very impressive, yes.
Well, that sounds like an exciting advance even beyond robotics, that you have more technology that has been layered on.
Yes. Yes.
What do you see in women's cancer and in OBGYN coming on the horizon?
Well, I was going to say we're going to be doing more of the sentinel lymph node dissections. A lot of times when we feel like we need to remove lymph nodes to make sure the cancer hasn't spread, the patient does not have any metastases in the lymph nodes, but we've put them through that additional procedure with the risks. The lymph nodes tend to be right next to big blood vessels, and sometimes patients get swelling, like in patients who've had breast cancer and had lymph nodes removed under their arm, have to worry about swelling. Lymphedema. We have that same issue sometimes when we do pelvic lymph node dissections. So I would say, as far as near future, it would be more use of the fluorescent feature of the robot to identify sentinel lymph nodes and minimize the number of lymph nodes we have to remove.
To be able to see that.
Yes.
And as you were saying, part of the way you're able to see that is the robotic system has a camera and the implements in the patient, and the surgeon is at the console controlling all of that,
yes.
And your vision is magnified and three-dimensional.
Right. Right. I tell my patients it's a little bit like the movie Honey, I Shrunk the Kids, where I feel like I'm a little person right there working on the patient. It's pretty amazing.
Like Miss Frizzle and the Magic School Bus.
Exactly.
Very good. Well, I appreciate your coming out today to talk with us about robotics and specifically what that means for women's cancer.
It's my pleasure.
Excited to have you at St. Tammany Parish Hospital helping us deliver world-class robotics close to home.
Thank you. Thank you. It's my pleasure.
Thank you so much. We'll be right back on Healthy Living with our third guest, Dr. Jacob Daigle, to talk about general surgery and how Da Vinci Robotics makes a difference in that area of specialty.
The North Shore. It's our place, where finer things are sometimes the simple ones. Social, sweet, and spirited, but always in harmony. Around here, life is about great things coming together. St. Tammany Parish Hospital and Ochsner, collaborating in the name of community.
Welcome back to Healthy Living. I'm your host, Melissa Hodgson, and we're talking today about robotic surgery. We spoke with Sunil Pruitt, local urologist, about how the program got started at St. Tammany Parish Hospital and how robotics increases urologists' capability to do surgery. Next, we spoke with Pat Brawley, who is a cancer specialist and an OBGYN. She specializes in women's cancer here in Covington and talked with us about how robotics has changed her practice. And last, we'll be talking with Jacob Daigle, general surgeon with St. Tammany Parish Hospital. Glad you could join us.
Happy to be here.
Thank you so much. So as a general surgeon, like urology and OBGYN, there is a component of robotics that really has changed your practice.
Sure, absolutely. Yeah, that's really something that's kind of blossomed in the general surgery field over the past few years. It kind of started with some simpler things in oncological procedures, colon cancers, but now is really expanded to things as simple as inguinal hernia repair or complex abdominal wall hernia repair. big hiatal hernias and anti-reflux surgery. It really has drastically expanded in general surgery.
Very good. And so some of those procedures that you've just mentioned, originally, if those were being done, they'd be an open procedure. And then some of them might have been able to be done laparoscopically, which of course is minimally invasive, but it doesn't have the advantage of robotics. So can you talk a little bit about what's different in robotics? I was saying an open procedure, well, the surgeon would actually be touching the patient and physically doing that surgery. And laparoscopy, similarly, right there at the patient's side. And robotics is different from that. Can you talk about that?
Sure. So, yeah, like you said, traditional open surgery, you're there standing next to the patient, over the top of them, doing whatever it is that's necessary. Laparoscopic surgery, it's similar, but you're holding instruments, almost kind of operating through small little, what we call, I tell people, it's like looking through a keyhole with a camera. With robotics, we're actually in the same room, but there's a console that we actually sit down and put our heads into and look, which provides the stable platform for the really good visualization. And the technology actually was originally designed for surgeons to be able to operate halfway around the world with intention for military purposes. So a trauma surgeon could potentially be doing a surgery halfway around the world on someone who was actually injured in combat. But the technology, obviously for delays we're not actually capable, but then that really blossomed the technology. So we're in the same room, we're controlling the robot, and it's really just a fascinating tool that allows us to do very specific, very good, fine detailed dissections in surgery.
Outstanding. Well, and you're talking about that console, and of course your visualization magnifies the image and it gives you that three-dimensional look at what you're doing, and then you have control of the robot at the console, and so everything that you do, the robot is doing, and that's inside the patient. So you're able to find that place where the work needs to be done. And Dr. Brawley talked a little bit earlier about seeming like you're able to shrink down and be in there because you're visualizing that anatomy on a level that you could not do in an open procedure or even in laparoscopy.
Yeah, and her analogy was really spectacular. I tell patients when comparing just the most advanced laparoscopy equipment, visualization is good, but with the robotics, the visualization for the surgeon is extraordinary. The comparison is really like taking a TV from the mid-'80s and watching TV and then buying a TV now in high def. It's almost that drastic.
Wow.
It's really extraordinary, and so you can imagine the benefits that provides the surgeon. It's a very stable platform. The camera does not move because the robot doesn't get tired. If you have a long, complex cancer case, the people that are holding the camera, there's natural fatigue that happens. The robot is a stable platform, doesn't move, provides extraordinary visualization.
That's something I've never thought about. You know, the human element, obviously we're all fallible.
Right, absolutely.
Can you talk a little bit about some of the procedures that you might do as a general surgeon, and then also talk a little bit about co-surgery?
Sure. So as general surgeons, as the term describes, general is pretty broad, and we do lots of things as simple to outpatient inguinal hernia surgeries that used to have really painful, long, prolonged recoveries, even though it would be an outpatient surgery. Now that doing those robotically provides tremendous benefits, and usually people come back at 2 weeks ready to go. We do, like I mentioned earlier, colon cancer surgeries. We do some anti-reflux and big hiatal hernias where people have their stomach halfway in their chest. We're really kind of pushing the envelope with the robotic surgery and using it for everything from benign cases to complex cancer cases. And as you kind of mentioned and with the previous guest, it really allows also for really good interaction between multi-specialists. So I've done cases in conjunction with Dr. Brawley. Maybe they have a part of their colon is involved with the cancer that she's trying to remove. And they particularly don't like to have to get into colon surgery. And so we can do cases together. With Dr. Pruitt, we've done cases, co-cases, where maybe there's two separate pathologies, something he's dealing with, something I'm dealing with. And in the instance that maybe there's accidentally an injury to something in a case, which obviously nobody wants to have, having multiple specialists trained on the robot really allows for excellent patient care where you can just have one physician chain onto the same console and really interact. I've done cases where the camera was looking upwards towards the upper abdomen, did my portion, Dr. Brawley come in, they spin the robot around, now it's looking down and she does her thing.
Oh, wow.
And patients literally still going home the same day.
That's outstanding. And you try to imagine, 10 or 15 years ago, those two procedures would have to have been done separately and under different circumstances, and that patient would have had their life impacted over the course of months for the two issues, where now the surgery date is one date and the recovery is combined.
Sure.
That's really revolutionary
It
for
is,
a patient.
it is really, really nice when those instances play well into each other and you can actually do that, but you're absolutely correct. One day, one surgery, take care of two problems at the same time.
We are so efficient in our modern times. That's really something. And we've talked a little bit about this, but St. Tammany Parish Hospital was the first robotics institute on the North Shore and has grown that program over the 12 years since it bought the first one. And now we've surpassed 5,000 cases. How do you see robotics impacting general surgery going forward?
Well, I can speak to the quality of St. Tammany's hospital's robotic program. I've been here for 2 years, and before that I was in practice elsewhere, and I can tell you that the robotics program at St. Tammany is head and shoulders above anywhere I've seen. And that really allows us to continue to grow. Now, obviously, it's been mentioned before, we have 3 robots. Really just allows us to have more access to the tool, to provide more care for more patients, and continue to try to push the envelope to make ourselves better, do more complex surgeries in more efficient ways, and get patients back to their family sooner than later.
Well, that's exciting. The hospital's mission is to deliver that level of world-class health care close to home on the North Shore so that patients don't have to travel. And the idea that we are pushing the envelope and we are developing those capabilities close to home really directs to that mission.
Absolutely.
Thank you so much for coming in today. We're
My
glad
pleasure.
to have you.
Sure.
This has been Healthy Living. We've been talking today about robotic surgery. We look forward to having you on our show next month.